Hi there, my name's Jen, and today we're going to be discussing basic skeletal anatomy, or the bare bones, if you will. So we're going to go ahead and start right here at the top of the head, or the cranium. The cranium is going to be separated into several different portions. The front of the bones here are going to be the frontal bones. The pair of bones connecting the top of the head and both sides are going to be parietal. I always think of parietal, reminds me of pair. Moving along to the side here, along your temple is going to be the temporal bone, and looking at the back of the skull is the occipital bone. A couple main bones to remember in the face are going to be a couple of your key facial features. The nasal bones of the nose, the zygomatic arch, which is going to make up those pretty cheekbones, your maxilla, or upper jaw, and then the mandible, or lower jaw. Moving on down, we're going to take a look at the vertebrae. The vertebrae can be categorized into three different types: the cervical, thoracic, and lumbar. The vertebrae are all going to be connected down into the sacrum and the coccyx, which are these bones right in here. It's a large fused bone between the hips. Moving along into the chest area, we have the clavicles, also known as the collarbone. You can feel a very prominent bone right here below your neck. The clavicles are then connected to the scapula, or the shoulder blades as we know it. Moving on down into the arms, we have the humerus, which is going to be the largest bone in the upper arm. Anybody who's ever hit their funny bone knows it's not too humorous. Knee slapper, I know. Moving down into the lower arm here, we've got two bones that are actually going to rotate over each other when twisted, and these bones are going to be the radius and the ulna. When trying to decipher which bone is which, you're always going to want to either think of the body or the skeleton in anatomical position, which, as we know, is going to be thumb out or laterally and pinky in medially. So looking at that, we can determine which is the radius and which is the ulna by seeing which finger, the pinky or the thumb, the bone is going towards. The ulna is going to come down to the pinky and the radius to the thumb. You can always remember the radius connects to the thumb because radius, radial, thumb is the only finger that you can rotate. Moving on, we have our rib cage. Connecting both sides of our ribs, the right to the left, is going to be our sternum. At the base of our sternum, we have the xiphoid process. This is a commonly broken bone during CPR. Moving on down, we have the pelvis, or the hips. The pelvis is actually made up of three fused bones: the ilium, the ischium, and the loess, which is the pubis. Going on now to the lower leg, we have the femur bone, which is the heaviest bone in the entire body and the bone that makes up our upper leg, or our thigh. The femur is then connected to the patella and a regularly shaped bone that makes up our kneecap. Down into our lower leg, we have comprised of two bones, the tibia and the fibula. The tibia is going to be the largest of the two bones, and you can remember T for tibia, T for tough. It's going to be the thickest, hardest bone of the two down here. The fibula is actually going to be the most common bone in the lower leg to break. You can see a better example right here of the tibia and the fibula. Thanks for that, Bob. Moving on down, we'll just go ahead and use this as a good example. Moving on down into the feet, as you can see, poor Bob here has had a rough semester. Moving on down into the foot, you can see that there are several irregular shaped bones making up the base of the foot around the ankle. These are also going to be known as the as the tarsals. The large bone that we know of as our heel is the calcaneus. Moving on down into the foot, we have our metatarsals, which are these long bones here kind of in the center of our foot, followed by our very end bones, our toes, which are our phalanges. the foot is actually very similar to the skeletal makeup of the hand. When we have the tarsals of the foot, we also have the carpals of the hand or the wrist, the metatarsals of the foot can be compared to the metacarpals of the hand, which are going to be right in here in your palm or your fist, and your phalanges, same as your toes. So now we're going to do a quick question and answer session. So I'm going to go through and I'm going to reference a couple bones that we've discussed and give you a couple seconds to play along at home and see if you've gained anything from our discussion today. So we're going to go ahead and start at the top of the head, and we're going to discuss this bone right along here at our temple. Give you about 5 seconds to think on that one and see if you get the correct answer. Okay, if you said temporal bone, you are correct. Moving on down our skeleton today, this sort of S-shaped bone right here at the base of our neck distinctly can be felt when we push on it. Give you a couple seconds to think on that one. What is this bone? If you said the clavicle, you are correct. Onwards and outwards for our questions today. What is the lowest bone on the pelvis or the hips? If you said pubis, you are correct. We're going to do 2 more before we call it a day here. When we're looking at the leg, the heaviest bone in the body that makes up our upper leg or our thigh is called what? If you said the femur, you are correct. And for our last question of the day, the bones that make up our ankle are called what? If you said the tarsals, you are correct. Thanks for playing along with me today, and I hope you enjoyed it as much as I did.